because it's competitive because you're Black. It didn't make sense to me. Um, but I got to realize that the Black experience can be different, depends on where you come from. And so I felt like, that hit me, and I respect it. I respect that people have different outlooks based on where they're coming from. But it opened my eyes to see that I had come from a place of privilege where I didn't realize. I never thought that I was limited. So when I went to do my fellowship, in a group of five, I was the only Black person. It was in Miami. That's a very diverse place. But when you look at the where I trained, and what the fellows look like, or the graduate medical education look like, and just the leadership and everything, it did not reflect a little bit the diversity in terms of it's a very Spanish, so you do have that, but not so much of the Black people. I did feel a little bit of imposter syndrome. I felt like, they kind of wanted a token Black person for diversity there. Um, but I was never treated, I would say, badly. It was a very supportive environment, but there's sometimes you project things on yourself. And so even if people don't come out and tell you things, you look around and you say, do I really belong here? I'm the only Black fellow here. I'm the only Black things. And you're projecting it. Nobody's treating you bad, but you're not carrying this on yourself. So I feel like I did have a little bit of that imposter syndrome during fellowship. I think it did affect me a little bit, where I kind of just wanted to lay it low. I didn't want to be like too loud. I didn't want to like be the one advocating for like okay, underrepresented, just like the one token person doing all the research in Black people that do research here, so I think it did play on my mind a little bit. I think generally though, I was not really ever going to be the person that was going to be the you know trying to aim for a top academic medicine kind of person. So I did what I did. I did it well. At the end of the day, in my third year, I was one of the chief fellows. So I mean, I think that went well, and I graduated, and I'm here in Tennessee. Looked for the job, Google, found it. I came here. I liked what it looked like. It was a appropriate job for me in terms of me wanting to do a little of everything. So it's a general practice, 4-day work week. So I've been here, this is my fifth year here, and I'm still liking it. In terms of how I'm appreciated here as a Black woman, I think that my colleagues respect me for the job that I do. And when you step into a place, you are gonna probably raise eyebrows. You look different, you sound different. A lot of it is gonna be genuine curiosity. People don't always, you know, think of the bad thing about difference. Some people are intrigued about difference, and you don't always have to let it play on you. My colleagues have accepted me, whether it be, all levels of staff. I don't feel out of place here. In terms of patients, I do think that, when I walk into the room, I don't look like what people expect a doctor to look like. Some will say, some will not. Some will say, up it's funny because just up until this weekend, somebody said that I look so young, like to be a doctor. And I've been a doctor for 13 years. So I told them I've been a doctor for 13 years. And um, I would say my patients don't usually play the race card too much, but I would say that it can be very covert, the microaggressions, right? And it's one of these things where you can't really pick it out. It might be, I can't understand what you're saying. I can't understand your accent. That could be code word for you're different. I mean, they can get away with anything saying, oh, I like to switch this doctor because I can't understand her. That may not be the real problem, but it could be a code word that they could use and, switch out or whatever. So sometimes you do wonder what is the real underlying issue, but it's not always something that is very overt. And like an interesting experience I had today where a patient in her 70s um, was telling me that she had a bronchoscopy where it was looking down her lungs, and she said that a colored doctor did it. So I was like, okay, I just went along. I didn't bring it to her attention. Um, I will say that I think that it depends on the generation that you're dealing with. Your expectations should be a little different. She's 70 something. She's not highly educated, probably doesn't even have a high school education. I don't think that she's a bad person. I absolutely don't think it was deliberate. I think it's just her educational level and her experiences. And she doesn't actually, she's not it's like a cultural awareness or, that kind of that sensitivity that she doesn't have. And she doesn't know better. So I don't hold it against her. I don't think it was intentional. I think if I was to tell her that it was offensive, she would be extremely sorry. So, however, if this was a 17-year-old person who would refer to somebody as colored, I probably would be offended because in this day and age, we have much more sensitivity training. And I don't think that I would expect that from somebody in that age group. So, especially, in this area where we live, people are deeply ingrained in certain things that seemed completely normal and right years ago, but is not acceptable anymore. So I think that was a little summary of what McKenna wanted me to go through. If there's anything that I missed, and otherwise we can do like a little Q&A. So
That was wonderful. You hit all the talking points and you just gave us an excellent overview of your career so far. Does anyone have any questions? Because I have questions, but y'all can go before me.
What advice would you give to someone who wants to do what you do?
in terms of like hematology oncology or like what I do like specifically.
No, just like someone who also wants to follow your path, yeah, your career path. Like, what would you tell them? Like,
Okay.
what would you tell your younger self, let's say?
Actually, I think some other things I would probably tell my younger self in terms of being in medical school. I would not limit myself to what was the status quo at the time. In terms of one of the challenges I had when I was applying for residency in the US, like, research was a big thing, and I didn't have anything to put on my application. And that's because my training, as I kind of told you guys, was very, very clinical. In the US, in the Caribbean, like research is not a big thing. If you don't do research, you're gonna get into residency, you're gonna get into med school. Like it really doesn't matter. And so I actually limited my my scope by just doing what was the status quo where I was. And then I wanted to move out of there and I was limited. It was not the strongest resume. I did good on my steps, so I had good scores, but it's gonna be a well-rounded application. You need to look at this and this and that. So I would say that's one of the things I would have done differently. Um, in terms of I think I have a little issue with like mentorship, and I think it might be a little trust issue too, or something. I don't think I have really good, I can say, oh, this is my mentor. And I've gotten by with it. I've done okay. But I think, that's probably something that I could have done differently, be a little bit more open, um, to really trusting somebody to guide me or um along my career path. So maybe that's something I would explore, tell somebody because there is a lot of importance. Sorry, give me a minute. Right. So there's a lot of importance for networking and people pushing for you and people talking for you. Okay. And so and that's something that's not um it goes almost in all realms that you need to have somebody to network, push for you, etc. So I think I could have done a little bit more in there. So that's important, mentorship, networking, not limiting yourself to your resources or your circumstances. So push yourself beyond things that you imagine that you are. Don't limit yourself, essentially. All right. Because you never know what opportunities will come along later.
I have a question.
Okay.
So I know at the beginning you mentioned that, or McKenna mentioned that you were married, and so I just was wondering, how if you feel like it's a struggle to balance like work while also managing like having a good social life, and if it is a challenge, like kind of what do you do to work through that or overcome it?
Okay, so it depends on what stage you are in your life. I I got married when I started I was done with everything actually. But I did have a partner from medical school. We were doing long distance for several years, like maybe 7 out of 10 years, and we kind of got married like late, like 10 years later, just because I was all over the place, you know. Um, and so it was easy for me because, you just Skype or WhatsApp or whatever at night. I didn't have to devote a lot of time for like going out or making time for a partner whilst I was in residency and all of that. And so I think one of the things that I had to do differently when I got married and started working was to make sure that I don't bring work home because when I was in fellowship, especially, as I said, I would say fellowship was the hardest part of my training. Somehow there was a very steep learning curve from internal medicine to oncology. And again, the environment that I was working in, I wanted to be competitive. I didn't want to seem like the person that just got through and is failing. So I used to camp out in that library every night. I really spent a lot of time in the library. And I used to do my notes, come from clinic, sit in the library, type my notes, and then I'd study. So I had this habit of doing my notes after clinic in the night. And I know that if I just got married, I cannot bring clinic notes home every night, you know? So that's something I had to be deliberate about. So I had to make sure that I finish my clinic notes at work. So when I go home, I can be completely, making time for family. And so now I have a little boy, he's like 16 months old, and I'm still trying to, keep that balance so that when I'm home, I have time for him. Um, I will tell you that being a working, successful woman, I feel personally, and I've had that conversation with one of my patients who is a successful lawyer, you don't really get any, and that might be vary from relationship to relationship. My husband is great, but I feel like generally a lot of successful women feel like they don't get any brownie points for being the one bringing home the bacon and also, carrying the weight, whether it be financially or whatever. No, you still have to be the mom. You still have to do this. You still have to do all the traditional women stuff. Plus, so sometimes I'm like, okay, I should have just been a housewife, because like, do I get off on anything? The answer is usually no. You don't get brownie points. It's nice that you do extra stuff, but you kind of still have to be the woman. Like you don't get off of these responsibilities. And as I said, it might vary from partner to partner, but I do hear that a lot. So being a working mom, a successful person, really and truly, sometimes that can, be extra work, really. But I think I make a good balance, I don't feel like I think I have a good work-life balance, and I think it's deliberate in terms of me trying to leave work at work and then make sure I'm present, not just physically, but mentally, for my family. And I work 4 days a week, usually, unless I'm on call, then I work the whole week, which is about once a month or once every 6 weeks. And so Friday, Saturday, Sunday, I have that time to spend with my family. We go to church, we go out. And so because oncology is very stressful.
Well, thank you.
I
That
have
was a
a
really
que-
good answer. Thank you.
I have a question. So especially for people who are wanting to go further into the medical field, trying to get their degree and stuff like that. Um, what what would you say, or like how can I word it? Or okay, for example, like what were some steps that you did like during your like schooling and stuff like that, even now being a mother, like for like self-care? Like how important do you know or believe like self-care, especially going through schooling, is important?
Yeah, it is important. And, I think that I was probably more a little bit like nerdy. I studied a lot. I spent lots and lots of time studying. And I mean, sometimes you have to do what you have to do, right? Um, but I think one of the things that kept me grounded in terms of self-care is having good friends and being able to offload things, even like my husband or like, just a partner to offload things on. Supportive family members like my mom. Prayer for me personally, like I'm a Christian and I always went to church as much as I could. I still do. So that's been a support system for me. I wish I exercised more. I try sometimes and just like definitely that's a good outlet for a lot of people, getting a good run in. I tried out yoga, have not been consistent. I loved it. It was just not only physical, but just like, the stretching, extremely relaxing. So I like yoga. I do it when I can. But for me personally, if I just like sit, talking, having a nice conversation with somebody, that relaxes me. That gives me some balance. And it is a little bit of self-care too, having people speak into your life and, giving you some perspective on everything. Like, career is just a part of your life, It's not, it should not be the only thing. And as I said, it depends on different stages in your life as well, because, back when I was in high school, what else did I have to do besides go to school? But there becomes a time when the balance kind of tips where there are going to be other things that are more important and should be a little bit more taking more of the weight on the scale. But the younger you are and the further you are out in your career, you're gonna have to put studying and these things as priority.
I have a question. Dr. Paul, in terms of your career, in your next steps, are you thinking about owning your own practice or staying within a healthcare system, stuff like that?
Yeah, so I think for now, I'm definitely planning to stick around here. And the reason is it's it's a little different for me actually staying somewhere. This is my fifth year here. I have not actually stayed one place for 5 years in a very long time, maybe when I was in med school. Because after that, I would spend 2 years here, 1 year here, 3 year here, 3 years here, just all over the place. And that was when I was like not married, didn't have a child. But you could just get up and bring yourself anywhere you want. If you want to do residency in Cali, you're single, why not? And so now that I have a husband and a child, I have to think about them as well. So I can't just uproot myself because I feel like moving to, San Diego or something. I have to think, is he gonna get a job? Is the school system gonna be good there? Is it gonna be diverse, for my child, which is something I worry about here. So there's a lot of factors that go into it, and I don't think it's fair for me to bring instability into other people's lives. So because of that, I think we're gonna try to plant some roots somewhere. As to whether will always be with Ballard, I mean, who knows? I don't know. I'm okay with working in the hospital system. There is a lot of frustration there. However, I think for now, because I have so much responsibility in my family trying to raise a baby, I don't know that I want to take on the extra responsibility of running a private practice. The financial risk that it entails and just the stress of being the person in charge. Like, so me being an employee, I don't have to worry about the how the business is running. I show up, I do what I'm supposed to do, and then I go home to my family. So I feel like for me right now, at this point in my life, this works. And later on, something else might work better for me. But for now, I think this is it.
I do believe Joelle typed in a question in the chat. She said, "What is it like being a minority healthcare worker?" And I know you touched on this a little bit, but maybe if you could explain a little bit more specifically at um, like your current job, if you've noticed anything since being in Ballad, any specific issues or, comfortability that you might have now that you've been there for 5 years.
Yeah, I think, you know, after you have been somewhere for a while, other things will speak for you besides what you look like. So I say that with much humility, but if I was if I wasn't doing what I was supposed to do and doing it well, then it would it would be an issue, and I thank God it has not been. I feel like people respect me for what I do now and not what I look like, at least from my colleague perspective. But every time you meet a new patient, it's going to be starting from scratch. Like a few weeks ago, I had a patient who, after the nurse put him in the room, he asked the nurse, "Where is he from?" Because a lot of people think I'm a man because my name is Dr. Paul. So the patient said, "Where is he from?" And she said, "It's a lady and she's from St. Lucia." And he went, "Oh, that's even worse than whoever," because he was coming from like Kentucky and had another doctor there who was probably a foreigner. And so they're like, "Oh, this is even worse than the other doctor that he had." And so me now walking into the room, this is what is predating me. This is the perception that he already has of me just because I'm from somewhere else. And that doesn't mean that just because I'm from somewhere else that I'm going to be a bad doctor. Like, what does that have to do with anything? So these are the things you have to put at the back of your mind. The patient who mentioned color, you have to put that at the back of your mind because you guys know, you cannot be seen as the angry Black woman. So you kind of have to just let things, not play on your head. So I think that there are lots of microaggressions and sometimes people don't do it necessarily. It's like out of pure ignorance. They don't even realize it is inappropriate. Um, and then these are some of the things that you guys may relate to. My story may not click for everybody. So yes, we're all Black women, but there are gonna be Black foreign women who also look very young. So like I'm young, I'm Black, I have an accent, I'm foreign, I'm a woman. So there's so many things that people might think, is she gonna be a good doctor? So you literally have to now prove yourself. And so as I said, for my team members and working with other people, I feel like I have been able to do that. But every new patient you meet, you start from scratch, having to prove yourself.
When building other relationships with like fellow doctors or just your like healthcare team, like the oncology nurse and other relationships like that, what is the most important thing for you?
I think that, especially with my nurses and stuff, I want them to be able to feel comfortable approaching me. Because if they pick up something that is not right, I want them to be able to come and say, "Hey, Dr. Paul, did you really mean this?" Or did the patient tell you that? Because sometimes they might pick up some information from the patient that the patient didn't tell me, they forgot to tell me, or you put in something you meant to do something else. So I don't want people to think that, "Oh my gosh, I cannot approach this doctor. She's so, unapproachable, she's rude, she's condescending, she doesn't want to be bothered." That can become a patient safety issue. So I like to have a respectful relationship with my colleague, meaning that they need to respect me as a doctor. They need to trust what I'm saying. They need to not, question within limits, but show respect. But at the same time, it should not be such a relationship where they're not comfortable with approaching me, because for me, that is very, very important.
We have another question. Ashley, I'm gonna read yours if she's having internet issues. But she was just asking about, I guess, like your research experience. I know again you mentioned that you didn't have a lot and like that was kind of a shock coming to the United States, but since being here and since gaining more professional experience, have you published anything and what does that kind of look like for you in the future?
Yeah, so I started out with like simple case reports when I was in residency. We did some, interesting patient cases. And then I also did some chart reviews, publish by reviewing charts and collecting data on some topics. When I went into fellowship, I worked on, again, some retrospective chart reviews. I did um, um, some meta-analysis. These ones you could get data off of the internet. So basically analyzing groups of other research, which I'm sure some of you are going to be more than familiar with. And whilst I'm here, I'm not like leading any clinical trials, but I do enroll patients on clinical trials because we have a few clinical trials in the office. So when I get the opportunity, I do still enroll patients on clinical trials. So that's some of the different levels of research that I've been involved with.
I have another question that I can ask.
Mhm.
So can you like walk us through a little bit what your day-to-day experience looks like in the workplace and kind of just I know you said you enjoy your job here and you like the balance that you have, but just kind of experience like explain kind of what that looks like before you got to this point as well, your day-to-day experience.
So uh, usually if I'm in the clinic, I'm working from 8 o'clock to about 6 o'clock because we have 4-day work week. So we're a little longer in terms of like compared to 9 to 5 or something on a 5-day work week. So my nurse will go ahead and room my first patient a little ahead of when I get to the clinic. We probably will start about 10 minutes after 8 or 15 minutes after 8 just because they have to usually do lab work. And so I walk into the room and see my first patient. Usually the first 4 patients are getting chemotherapy. So we're checking to see how they're doing on chemo. We're reviewing scans if they've been on chemo for a few months and we need to see if it's working. Sometimes we have to change treatment. So that's some of the things that we do a lot. And seeing new patients with new diagnosis. Interestingly, we don't give, most of the times I give bad news, it's going to be like a scan is bad, but I don't usually break the diagnosis for people because a lot of the times people come and they already have a biopsy from their primary care doctor. So they already know they have cancer. They want to just, sometimes they want to know what's the stage or what the treatment options are, right? Um, and so just give me 1 minute. Okay, so outside of that, we like I said, we see new patients and I see hematology and I see oncology. So sometimes I see like no anemias, etc., iron deficiency. I have a break at between 12 and 1 for lunch, resume at 1, and then I see my last patient at 4:40. And then I take the next hour and a few minutes to finish up my notes. And then I go home. I try to leave between 6 and 6:30. And when I go home, sometimes I can get a workout in. Sometimes I'm not so good with that. Or just spending time with my baby and letting my husband have some time for himself as well to go to the gym and stuff. He's much better with the gym than me. I think, I've had that pattern for quite a while. Sometimes people struggle with, being able to finish their notes and get out of work on time. But I've been so deliberate about it from the beginning. I don't think it had ever been a major problem. Of course, you have some days that are gonna run later than others, especially if I have a challenging diagnosis. I have to talk to other specialties a lot. I have to be on the phone. Anything like that can run you late because the patients, they're scheduled 20 minutes, 20 minutes, 20 minutes. But in real life, how many times are things actually going to fit into the time slot? So sometimes things are going to run over. So I may have a day where I have to say, I'm coming home late, and I might reach home 7 or a little after 7, but that's occasional. And it's okay, if you're likewise, I may have days that are light where patients don't show up and I get to leave early. So I think it all balances out. I think generally, I think I'm okay with leaving the office at a reasonable time, and I don't get like disturbed on the weekend because we take turns to be on call. So if it's my call, then I'm on call and I can be disturbed. But if it's my colleagues' weekend off, I'm not calling them to ask them questions. We try to give people a break because in oncology and cancer care, it can be hard, and um just patients can be harsh sometimes. They don't get the outcomes that they want. They can be mean, they can say mean things, they can say anything they want anywhere they want. It's not always, nobody really comes into medicine to mess up anybody, and sometimes it can be hurtful. But I think that's one of the things I had to learn over time. And you know the first time you have like a bad review or something, it's like really crushing because I think a lot of us overachievers, we're perfectionists. We want to get A's all the time. We want 5 stars all the time. And my mom had to tell me, not even Jesus was liked by everybody. So you're being unrealistically hard on yourself. And so at the end of the day, I hold myself to a standard to do my best for patients, to do standard of care, to not, to make sure I'm treating people like I would want my family. And if I cannot do it, to refer them out to a Vanderbilt or Duke or somewhere that they want to travel, because there are going to be some difficult cases, very rare situations that you need a super specialist, to deal with. And so if I feel like it is not something that I'm comfortable with, I need to refer them out. And so we do that as well. And so that is what I hold myself to, that standard, to do my best for people. And the way they perceive me is not something I can control.
Thank you so
Seen
much.
online,
Oh, sorry.
I've seen online that about 5% of oncologists are Black. What can we do as people in the National Society for Black Women in Medicine to improve those numbers and get more Black women and Black people in general in oncology?
Yeah. I'm not really sure what is responsible for that. As I think, is it that Black people are not interested in going to oncology? I don't know. Is it that it's hard to get into it? It is. It's probably one of the um top 3 or 4 specialties in terms of coming out of internal medicine, in terms of competitiveness. Um, and but I think, if you were really to do the math, like what percentage of Black people are in medical school, what percentage of people, like you really have to start going back. Are kids graduating from high school? Are they going to college? There's a bunch of prerequisites before you can actually get to that number of how many people are going to be oncologists. So if you don't have that N is equal to whatever, the numbers are not gonna be high at the end, because are they getting into medical school? Are they getting into college? So I think that's one of the issues there. I don't know that as Black people, we're not interested in oncology. I don't know that it's not an interesting or attractive specialty, because you can make good enough money. It's not surgery, but of the subspecialties in internal medicine, outside of cardiology and gastroenterology, it would be right up there after that. So I think financially it is attractive. Quality of life is not bad. I think it could be stressful in terms of seeing people sick and dying. I think it scares a lot of people. And sometimes people look at it as a superpower to be an oncologist. Um, so yeah, I'm not sure that I can really explain it, but I don't know that it really has to do with well, I would guess that it's just that there are not that many Black doctors anyhow.
Does
And
anyone
it is
else
a
have any
generational thing, and hopefully it gets better over time.
Does anyone else have any other questions?
I have one more. Okay. I know you talked about your faith and how oncology is like a very draining and demanding field. So, how does that intertwine with like the mental tiredness it can bring and like the defeat you could sometimes feel?
Yeah, so it is that's a good question. This is something that I myself struggle with sometimes. And the reason I do is because I'm such because I have such strong beliefs, and even in other aspects of my life that I trust God to work in. And I sit in the clinic and I hear, I mean, it was like 2 days ago, I had a patient who didn't really want to do chemo, and he was talking about he trusts God to heal him. As a doctor or as anybody in medicine, whether it be a nurse or, anesthesiologist, anything where you're going to be trying to offer somebody some intervention, at some point in your life, you might hear somebody say, I trust God to heal me. As a Christian, do you tell them that doesn't make sense? That's a challenge for me, because I trust God to do other things in my life. So why should this person not trust God to heal them? So I have a challenge with that. But what I tell myself is that um, I'm not the pastor, I'm the doctor. And in this role right now, my role is to offer them what they came for or what they came to learn about. So we're not going to have church in the clinic today. We're going to focus on the chemotherapy. And but I'm going to respect what they're saying. I'm going to validate what they're saying, but at the same time, my primary role here is to talk to you about your cancer, your chemotherapy, your medical options, what will happen if you don't do anything. That is my primary responsibility. So I will acknowledge, I will validate, but I will not, and I will not negate their feelings or whatever they have, but I'm not going to put um my science on the back burner when I'm in the clinic with the patient. Um, and on the flip side, in terms of how the faith really helps me. I mean, when I'm having a bad day, when the outcome is not good, when I feel like I could have done something better, when I wish a patient didn't say something that bad about me, it helps me to just, peace be still, like to really just get grounded and understand that everything is not in my control. At the end of the day, I can't even heal everybody. I'm limited in what I can do. I am to bring my best to the table, and at the end of the day, I'm not in control of everything. And so that kind of puts perspective for me when things don't go the way that I want to. And that has been and continues to be a big part of my life. It just really puts things into perspective.
Any other questions?
Thank you so much, Dr. Paul. This was very informative, and just thank you for taking time at the end of your day to get this done. I really appreciate it. Can we give her a round of applause, guys? Thank you.
All right. So thank you, ladies. I wish you guys all the best. 30-second pep talk. Everybody's job is important. I was intrigued to find out it was not only like aspiring medical doctors. I thought it was. But just to reassure everybody that there's a role for everybody in healthcare. I have a team. I work with nurse practitioners who are, like really supportive for me. My nurse, the patient navigator, it's a team effort. And everybody doesn't have to be a doctor. Everybody cannot be a doctor. Go whatever you set yourself to do. One of my mottos is I must be the best version of myself. So if you whatever you're gonna be, you be the best version of that, and know that you bring value to the table. Don't let anybody limit you because of what you look like. And I would also say take advantage of the things that are there just because you look like what you look like. So there's going to be this for minority or that for minority. Take advantage of these things too, to sort of even the table out. But I think that everybody should just go for whatever you set yourself at, and don't let anybody limit you, and make sure when you show up good, because you best believe that there's going to be that other Black kinesiologist after you that you're representing for, and you want to set a good name for, because they remember when they had that doctor, or remember when we had that Black this person. So you can make a way for somebody, or you can close doors for people, and you don't have to be at the top to be doing that, because even in ETSU right now, there are going to be people who are going to come after you. So people are looking at you and looking at other people who look like you next year or the year after. So everything you do, you need to represent well. Okay.
Thank
Bye.
you so much. Thank
Thank
you.
you.
All right. Good.
Bye.
Mm.